Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak to Dr. Mona Hanna-Attisha, a pediatrician at Michigan State University who brought to light the water crisis of Flint, Michigan. We speak about recent progress in Flint and how steps taken to reduce the impact of lead poisoning in children have actually prepared the city for COVID-19. Dr. Hanna-Attisha also shares some lessons of Flint for all the other places in the country now coping with unfair and preventable health crises. Let's listen. Dr. Hanna-Attisha, I can't tell you how excited I am to have you on the podcast. Thank you so much for joining me.
Josh, it's always great to hang out with you.
So I want to start with where your great book, What the Eyes Don't See, where that ended, the Flint water crisis, the fact that there were so many children exposed to excess levels of lead. You played such an central role in bringing that story to the national consciousness. What's going on with those kids in Flint now?
Yeah, thanks for asking me, Josh. And I think that was the hardest part about writing a book because there was no clear the end. The crisis was not over then, and it's not over now. So some great things are happening in Flint. I know Flint's kind of been away from national headlines, understandably so, because we have a lot of other things that we need to deal with. We're almost done replacing our lead pipes, which is amazing. They're supposed to be done by 2020. We took a short pause during the pandemic, but all our lead pipes will be replaced soon. And that will make us just the third city in the country that has replaced their lead pipes behind Lansing, Michigan, and Madison, Wisconsin. So that's fantastic news. And then how I get to spend my everyday in Flint is making sure that the kids who have been exposed to this preventable public health crisis with widespread lead exposure and an outbreak of Legionnaire's disease and skin issues and just kind of overwhelming community trauma, my job is to make sure that those kids, have the brightest future possible. So from the moment of really kind of recognizing what was happening in Flint, our focus has been on secondary prevention. So we failed at primary prevention, that really important concept in public health, where we should never expose a population to something like a neurotoxin like lead. So our focus has been really leaning on the science of child development and early adversity and resilience to put into place the interventions to promote and protect the health and development of children. So there's awesome things happening there, and kind of it's the continuation of those efforts that really kind of consumes my everyday, and to make sure that we can do these for as long as the kids need these things.
That's great to hear, but I imagine the pandemic has interfered in some respects with the ability to keep kids on a upswing in Flint.
Yeah, that's an excellent question. Imagine a city that is starting to recover from one man-made preventable public health crisis that is now in the midst of another preventable public health disaster. So we were just kind of putting into place the infrastructure to support children and families. And then a lot of that was put on pause because of the pandemic. Obviously, schools were shut down and childcare facilities were shut down, and other resources and enrichments for family, including things like really important developmental assessments and school intervention services. And on top of that, Flint is a community like so many disparate communities that were hard hit by this pandemic. This pandemic, as we first were told, is not the great equalizer. Certain communities, predominantly minority and predominantly poor communities, have greater risk factors. Outside of the Metro Detroit area, which was the hardest hit spot in Michigan, the next hardest hit spot was the Flint area. So here is a community, once again, struggling to recover from one crisis where government failed, and now is in the midst of another crisis, threatening kind of the health and really everything that we've been able to put into place for this very vulnerable population.
Did the structures that have been mobilized to protect kids from the long-term effects of lead help at all as this pandemic started?
Absolutely. So because of our last public health crisis, we were able to build some public health infrastructure. One of those things is the Flint Registry. It's supported by CDC to identify folks that were exposed to the crisis and most importantly, get them connected to the resources to support their health and development, like Medicaid expansion, like early literacy support, home delivery of children's books, trauma-informed care, nutrition services, and then continue to follow folks over time. So because of our work in improving public health, we were actually designated by the CDC as a public health authority. So this registry has been up and running for a couple of years now. Over 30,000 people have, begun the enrollment into that registry. And then the pandemic hit. I'm like, what do people need? People need nutrition, and they need education enrichment, and they need healthcare access. So fortunately, because of that infrastructure we built because of our last public health crisis, we were more than ready to support families during this public health crisis. So it's really an important lesson on the need to be proactive and preventative and invest in the capacity to support communities.
It's very interesting. I mean, what you're really talking about is applicable to other places besides Flint. So essentially, because of what happened with lead, you knew which families might be at risk for going hungry, for example.
Yeah. So because of our water crisis, we knew, we were dealing with a community that, had this overwhelming trauma and had these potential adverse consequences. And we had been working in a very kind of community-informed and community-driven way to rebuild trust in our community so that they could participate in public health promoting interventions. Because of that groundwork that was built with community, we were ready to step up when this pandemic hit. Obviously not enough, and there's still a lot of work that needs to be done, and there's still a massive underinvestment in these resources. But because we were trusted partners already in the community, and once again, working hand in hand with community, we were able to be more effective.
When this all started, people, meaning the pandemic started, the story of Flint was really the story of Flint. People really understood what happened. You told it so well in the book. And there were sort of echoes in other parts of the country, maybe. How has the pandemic shifted, if at all, that perspective?
I'm so glad you asked me that. And, it's one of the reasons I wrote the book, to share the story of Flint, but really to share with folks that this is a national story. That, it's about that one city over there that had brown water coming out of their tap, and but it's more than that. It's about so many of the deeper crises that we're in right now as a nation, and the pandemic couldn't be more relevant. The lessons that we learned in Flint are the lessons that the nation is learning right now. And for me, I see that as a silver lining. I am this eternal optimist. I'm like, yay, the whole nation is acutely learning what we learned in Flint, and maybe we can hopefully learn these lessons. So in Flint, we learned that we need good governance. We need leaders in charge who value public health rather than dollars and the economy. So that was one of the reasons that we got into our mess. That's very relevant with this pandemic. We have really a failure of leadership at the federal level to respect public health. In Flint, we learned that we need to respect science and facts and scientists and medicine. The lack of proper water treatment, the dismissal of scientists throughout our Flint story also resonates to what's happening today with science and facts, and especially those in public health and medicine. In Flint, we also learned that we can't just react to public health disasters. We have to proactively invest in public health infrastructure. Our public health infrastructure, from our water treatment to surveillance systems, failed because of chronic disinvestment and lack of resources. We are also seeing that with this pandemic, as nationally, we're not ready. Our public health systems have really suffered from decades of austerity and can't muster what we need to muster right now during this pandemic. In Flint, we also very acutely learned the story of disparities. The crisis in Flint never would have happened in a richer or wider community. It's kind of this emblematic environmental and health injustice. And that's been kind of cited, in several reports, including from the Michigan Civil Rights Commission, and the list goes on. And that's what we're learning once again in this pandemic, that, the issues of inequities, income inequities, health inequities, injustices, racism, all these longstanding issues provide some communities with clean water and some communities without that. And some communities have greater risk factors to things like, pandemics, and some don't. So some of the very, very same lessons are being learned at a national scale.
So given that in Flint, you've actually been able to make progress, you got people's attention. People really recognize this as a matter of right and wrong, and they're actually investing in the kinds of infrastructure and programs to make a difference. What are the implications of Flint's experience there for the national experience for the pandemic?
Yeah, I definitely see this crisis as an opportunity to learn and to build and really to rebuild. The New York Times did a series a couple months ago called The America We Need, and they asked me to write a piece. And my piece was, I'm sick of asking children to be resilient. And, it's all about how do we learn from this pandemic? How do we grow? How do we build a new America where public health is valued, where we are driven by science, and where we strive for equity? So I absolutely believe that we can move forward in this direction. We're trying to do that in Flint by being governed by the science of not just what works for families and children, but really what works for communities, what enables self-determination and participatory democracy, what builds equity, what provides economic development. All of these things are critical ingredients for the success of communities and ultimately their health and most importantly, the success of our children's trajectories.
Well, I think it matters that you not only were involved in identifying the problem, but you've committed so much to addressing the challenges in Flint. I think that is a lesson for a lot of people, that it's one thing to recognize the challenges with the pandemic, but really to roll up your sleeves and get in there and try to turn the tables on these problems. And it's not something that's an easy fix.
No, I thank you for mentioning that. I definitely don't want to be known for blowing the whistle in Flint. I want to be known for what we did next, what we did together, kind of in partnership with so many folks to mitigate the impact of our crisis and to share our best practices with communities everywhere. Like I said earlier, the Flint story is not isolated. It's a story all over this country, especially for our children that wake up to some of those same nightmares as Flint kids, where be it their zip code or their school district or their drinking water source or their color of skin or state of birth, country of origin, where all those predictors play a greater role in their outcomes than their potential. So, my story, the Flint story, is this kind of nationally relevant story at how we have to really all kind of open our eyes to injustices that are happening, be it kind of in our communities or as a nation, and not just kind of recognizing or kind of blowing that whistle or sounding alarm, but doing that hard work of making sure that this doesn't continue. We bucked the status quo. We did the impossible. If anything, kind of my story is a story that we don't have to accept what's going on right now, and we can work to build a place, that is more fair, more just, and more resilient for our community.
So well said. Thank you so much for joining me on the podcast today.
Josh, it's always great to talk with you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.